Mohawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show, Fight Against COVID-19. We are very excited to introduce a panel today, and it's our first live show. So thank you first for helping us promote the fight against COVID-19. I have a wonderful panel to talk about COVID-19, a panel full of doctors, nurses, and a physician assistant. Our goal here today or in future episodes would be to talk about COVID, answer some of your questions, and basically see how we can help the community with this panel. So without further delay, let me introduce the group of panel and experts today who will talk about COVID-19. I have Dr. Patel. Dr. Patel, would you like to introduce yourself, please?
Yes, I'm Dr. Ankit Patel. I work as a hospitalist at Melrose Wakefield Hospital.
And that I have Dr. Osman.
Hi, I'm Dr. Osman Kayu. I'm a hospitalist for Altion Health. I work at Southside Regional Medical Center, which is a large tertiary center in Richmond, Virginia, and I'm also the facility medical director for Rappahannock General Hospital, which is also near Richmond as well.
Thank you. Then I have Kimberly.
Hi, my name is Kimberly Principato. I'm a nurse practitioner. I also work at Melrose Wakefield. It's a small community hospital outside of Boston.
Thank you. And then I have Kristen.
Hi, I'm Kristen April. I'm a physician assistant. I currently work.
Kristen, we are not able to hear you. Maybe there's you can speak a little bit. Yes.
Can you hear me now?
Yes.
Sorry. I'm Kristen April. I'm a physician assistant. I'm currently working at the ICU in Melrose Wakefield, which was a previous position for me a couple years ago, and I was redeployed from my active position.
Wonderful, thank you. So as you guys know, the topic is COVID-19, and there's so many things that we can talk about. But let me start with first kind of going through the experiences that you guys have in terms of what you're doing, and then maybe we can just talk about some questions. So I'm going to start with Dr. Osman and talk about what you're doing in terms of COVID and how do you see these patients?
Sure. So I have a pretty interesting experience, being that I work at both a large, tertiary center and then also at a small rural community hospital where I'm the director. Currently our census for COVID patients at the larger hospital is we have 30 in-house patients, 19 people under investigation. There's 32 ICU patients. Total, we've discharged 45 patients that were COVID positive and did well and were able to go home. And we've had about 24 or 25 deaths related to COVID. At our smaller hospital where I'm the director, we've had much less cases. Offhand, I think the number of total COVID patients in-house, I think currently is about 5 or 6. But overall, in the last month or so, we've had around probably 20 to 30 come through. I don't know the numbers offhand of, who kind of recovered and who didn't. But yeah, so, at the larger hospital and at the smaller one, we have similar, it's all part of the same health system. So we have it's similar protocols as far as, how to treat them. We have dedicated COVID units that we've made. We've effectively turned the medical ICU, which was, a large medical ICU, into just a COVID unit, and then made our PACU into the regular ICU, the medical ICU. At the smaller hospital, we've had to take, certain other measures because, of course, they have much less resources. So I was instrumental in setting up basically wings of the hospital as COVID hallways, where we had to kind of improvise a little bit and make isolation units out of entire hallways, and turned basically every room into negative pressure rooms, because the hospital only had 2 negative pressure rooms in the whole hospital. So, with the help of the engineering folks and some little ingenuity on their part, we used the HVAC systems in the hospital and turned everything in that 2 hallways into basically negative pressure hallways.
That's something. That's really, thank you for providing that background. Kimberly, can you give your background? How do you deal with patients day to day?
So I work in the ICU. We have 2 ICUs for a total of 12 beds. I'd say we're usually at 80 plus capacity for the ICU since COVID. It's definitely a challenge. We had the same issue as far as not very many negative pressure rooms. And our ICU rooms have curtains, so they just converted our entire ICUs to isolation negative pressure through the engineering folks. It's definitely a challenge, because once you go into the ICU, you're gowned and geared, and you can't eat, you can't drink, you can barely hear, it's difficult.
It's difficult, yeah.
I think that the first couple of weeks were very shocking for everybody, and it was an adjustment for everybody to accept what was happening. But I think that over time, the entire unit has really adapted really well, and it's been nice to see how well people are working together within the unit.
Thank you. Kristen, can you give your back? How do you deal with these patients? How do you treat them?
Yeah, sure. So we're frequently called to see patients on the medical floor or the emergency department who are requiring high levels of oxygen support, or who are already showing evidence of multi-system organ failure, whether they have septic shock and need vasopressors, or acute kidney injury, or looking towards needing dialysis, or electrolyte repletion. Unfortunately, people seem to have been so terrified of COVID that a lot of them are kind of suffering at home and frequently coming in very sick. So we're called pretty frequently to intervene and assess these people. It seems like the trend as far as COVID has really redirected as far as necessarily urgently intubating versus trying some of our other less invasive measures. So we're kind of taking it one patient at a time and seeing what's best for their comfort and what we think they'll be most successful on, which too is a novel approach, and taking it case by case and, kind of working as a team and getting all our expert opinions as far as creating our care plan.
That's wonderful. Thank you. Dr. Ankit, could you give your experience?
Yes, I think fortunately I get to work with Kristen and Kim here as part of the ICU. So I think as I would agree with all of the people here, and it's more of a teamwork. I think giving the ICU a heads up right from the admission time, or if there is any patients that you might feel might be unstable for the later in the day or the night time. And it's back and forth between the ICU and the floor. So I think our team communication dynamics is extremely important here. So we can avoid any kind of unwanted outcomes.
So, is there a hope here? Any one of you guys want to say, is there a hope? What do you guys think?
I think the unknown is what's been most difficult to cope with, making hope difficult. But I think that, we've been seeing it for about 8 weeks now in Melrose. And I think that we were challenged with seeing not very many good outcomes the first month or so. But I think, as Kristen said, as we've been trying to kind of delay intubation for an absolute last resort versus the early intubation that we initially thought these patients would need, it seems that we've had a bit more better outcomes. I think that the mortality rate is still very high once you become critically ill, but seeing that slight improvement gives us a little bit of hope.
What do you guys think? Any of them?
Well, I tend to be more on the optimistic side. So I do feel that overall, as they say, this too shall pass, as other things have. But at the same time, this is an illness that I've kind of I've never really seen anything like it. It's very, very unique in the sense that I find that there's no real rhyme or reason to, who gets ill, who doesn't get ill, who recovers, who doesn't, how fast people can decompensate. Just to give you an anecdotal story here, one patient that we have on the floor, was a 80-year-old lady that had COPD and was on 3 liters of oxygen normally at home, and she was COVID positive, made it out fine, and she's recovering great now. On the flip side, I had a 50-year-old woman that had no comorbidities that I treated for about a week. And despite, we had the whole treatment protocol, the hydroxychloroquine, azithromycin, Actemra, all those things. And she looked like she was doing great. We had her down to only about 1 liter of oxygen left. And the day that my shift ended, because I work 7 days on, 7 days off. So the last day of my shift, I spoke to her husband and said, she's doing great. She should be off oxygen and she should be home, by Thursday, Friday. And by the time my next, week rolled around, I opened up my patient list and I was shocked to see that she was deceased. So it was really, really, one of those things that was kind of very disheartening. Apparently she had developed some neurological symptoms. So I think there's a lot of things that we still don't know or understand about the manifestations of this disease. I think the hope basically lies in time and the development of a vaccination that will be effective. Beyond that, social distancing measures, and that's really all we can do.
Anyone else? What do you guys think?
I think, working in the same unit as Kim, sometimes it's hard being in the ICU bubble and seeing the sickest of the sick. And unfortunately, in Melrose, we've had a large nursing home community that have been affected. So we're getting kind of very sick baseline people who just have really poor outcomes to be expected. So it's easy for us sometimes to forget that there are healthier COVID patients that Dr. Patel is taking care of and fortunately discharging on the medical floor. So there, like Dr. Assman was saying, is a large variety of what we're seeing.
Yes, I think it does feel good to discharge any COVID patient, even if it is 1 or a single-digit number. But I think it does happen. So.
So our goal for the panel in future, as the day was an introductory call, we're trying to get some of the questions answered from people. What are some of the questions that you get that we should talk about in the next future panels?
I think the one question that comes to, or many people have asked me, is how do you maintain the level of communication with all this gears and with the family isolation and everything? So that's something
the human touch. How do you maintain that? Are there other questions that you guys think that we should talk about? Our goal would be to try to come up with a list of questions and talk about that in detail. Are there other burning questions that people ask?
I get a lot of questions about, well, the patients that you're seeing in the ICU have comorbidities, right? And it's not always the case. And I think that, a lot of the younger population wants to hear that, we're only seeing patients that are chronically ill and all of that. But it's unfortunately not the case. And we do still see people that are otherwise healthy and, on the younger side.
Okay. I think, in terms of trying to, basically, a lot of questions people ask is that, how do you guys feel going into the hospital or the clinic? Any thoughts there? I mean, I'm sure there's some people say we are scared. Some people say, that's our job. Any thoughts?
I mean, I think if anybody, the majority of people, even if as much as they may say that they're not a little worried, everyone is a little worried. we've all heard the stories of how many people, healthcare workers, have been affected and died, and in New York in particular. And not only that, for those of us that have families, we're concerned about them as well. Bringing something home for and affecting them. So of course there's a level of fear there, but at the same time, you just kind of tell yourself that this is what you kind of trained and signed up for, right? And if you're not going to do it, then who is?
Yeah, no, absolutely. I think that is the case. So I think in terms of trying to make sure, what is the topic that you would like to discuss next panel? I would just like to kind of talk about some of the, like maybe human touch and interaction as a physician or as a nurse or as a PA. How do you interact? Would that be a good topic to discuss in the panel next time?
And I think the facilitation of families communicating as well, kind of just in that spirit. Okay.
I think one good thing would be, especially, I was talking to Ankit about this earlier, is especially in our Desi community, there's a lot of misconceptions about different remedies, different things that the treatments, all these different things. I can't tell you how many texts I get from my mom about different things to do, and so if we can dispel some of those myths, I think that would be very, very informative and helpful. That eating an onion will not treat COVID.
Exactly. No, that's a great point. Ankit, any thoughts about you?
The emphasis on the ongoing social distancing for the next couple of weeks or months,
Absolutely.
so that raising awareness about the severity, as Kim was mentioning, about the younger people as well, might help change the community perception.
Yeah, especially when the things are opening up. So that's critical. So I just want to kind of thank you for today. I think it's a great start. We will really, I feel that there'll be a lot of options where we can discuss. So hopefully we can discuss this question about social distancing as well as the interaction with patients next time at the same time and the same day. And we'll be very excited to get to and talk to you further.
Thank you so much.
Thank you.
Thank you, guys. Have a very good night. Thank you for coming on the show.
Yep. Thank you.